Okay. Good evening, everyone. Salam alaikum. I can see the participants coming in. Thank you so much for joining us. And for those that are coming in, I'm Maysaa. I'm going to be your host tonight, a facilitator, actually, for this amazing conversation. We're going to have a really important conversation, actually. Firstly, as always, Bismillah ar-Rahman ar-Rahim, I'd love to welcome everybody today. And I'd like to thank God for really giving us this opportunity to speak. Without him, nothing's possible. I'd like to acknowledge the traditional landowners on which we congregate on in our own homes anyway, both past and present. So we're here today to discuss, the community-specific COVID issues that we are experiencing, whether it's personally, whether we're reading about it, and of course, we are all reading and hearing about it. Tonight, we're going to be together for about an hour. We're going to be hearing from each panelist who each has a different perspective, different experience, and different specialty. Really important to note that none of the panelists here today, myself included, the IMA, have been paid or funded to do any of this. This is purely done as a community announcement, as a community to come together and understand something that you might have misread something, or you might be confused about a certain element about COVID itself and the Delta variant that we hear about. The intention is clear. It's a discussion to clarify, to understand from our own community members, as well as, a government representative, that there are struggles in our community. There are struggles and there's a lot of confusion. Maybe there's a lot of fear, and how we can help ourselves come out of lockdown. Tonight, we're going to hear from Dr. Hussein, a GP, Dr. Rafehi, a senior research fellow at the Walter and Eliza Hall Institute of Medical Research. We're going to hear from Rima Darwiche, a CEO of CPL Australia. We've got Jeroen here, who's the Commander-in-Chief for COVID here in Victoria, and he'll be giving us an overview of the current outbreak. And we've got my friend, and somebody we're going to hear from, Nasrein Zahraman, who will share her real life experience with COVID as she's experiencing it at the moment with her and her family. So with that being said, thank you everyone. And Jeroen, hello. Lovely to see you tonight. And thank you so much for your time. I know that you've done quite a few of these and we're really appreciative. Tell us, so give us an overview of the current outbreak. How are the cases looking? An update on the spread.
Yeah, Maysaa, thank you so much, and salam alaikum, everybody. It's a real honor to be here with you all tonight, and thank you for giving me a little bit of time. And if at any point you want me to leave, I will not be remotely offended if you would rather have me do that. So my name is Jeroen. I'm working in the COVID team with some wonderful other people, some of whom are on the call as well today. We're obviously quite concerned now about the latest COVID cases we've seen really over the last week or so. And we saw the early, about 3 weeks ago, we saw a number of COVID cases, quite a few, particularly in some of our schools. Obviously, we spent a bit of time talking about Al Taqwa, Heathdale Christian College, Mount Alexander College, and they all had quite a few COVID positive cases. But the school communities and the school families did a wonderful job of isolating, of supporting each other in isolation, and organizing and just supporting the community to isolate. And we've seen really good progress with that work. And actually, a week ago, we were quite confident that most of that was under control, and we were hoping to be able to get out of those restrictions. What we've seen in the last week is increasing number of, not huge numbers of cases, but 5 cases here, 10 cases there every day, particularly within some of our larger households and larger family groups, and particularly in the western suburbs. So today we have we have 600 cases of COVID in Victoria at the moment. About 150 of those cases are really quite closely defined in the western suburbs. So Newport, Altona North, some down in Wyndham, and they're all, we think a lot of them are related to the men in the community who are still who are doing essential work, and they're going to work every day, and they're coming into contact with other people and then picking up the virus. There's a little bit of social contact we're seeing where people are still out and about a little bit more than we would probably like. and we're seeing some transfer of the virus in that way. But what we're especially seeing is that when COVID gets into a family, into a house, it spreads rapidly to everybody else in the house, and particularly where there are a lot of children involved. What we've seen this time that we haven't seen before is huge, really large numbers of children getting COVID. So we have about 120, 125 children with COVID under 10, really young children under 10 with COVID right now in Victoria. We have about another 100 children between the ages of 10 and 19 also with COVID. So, 220, 230 young people with COVID. Now, and only one is in hospital, thankfully, but still it's quite a worrying sign. So what I think one of the reasons we're really keen to share this conversation is how we can help and support families to isolate properly, to minimize the risk of COVID coming into your family. And we're really trying to find ways of how do we best get that message across, and what support can we provide people so that we minimize the spread. Because if we can stop COVID jumping from one family to the next family to another household, then we can get, if the numbers can come down, we can then ease off the restrictions so we can all start moving around again. Maysaa, there's a lot of other people, and I will stop and happy to take any questions or be part of the discussion.
Yeah, I'll just jump in and ask you, so what are we hearing? What are the main ways that transmission has been occurring? Yeah,
so we saw it a few weeks ago when the schools were open at school. So a lot of children were passing it on within 2 or 3 of the very big schools we had. That's no longer a problem because the schools are closed. We're seeing a lot of transmission within the home, and so people who are living together it's very hard to not spread it amongst your family when you're living together. So if one of you has it, very likely everybody will get it over the course of a week or two. We're also seeing people moving from one house to the next, and this is really hard with large extended families. That's really hard, I know. If your mum lives 2 streets away, supporting your mum, handing over some food, we are seeing examples where the virus is getting transferred that way. So we ask people to be very careful with that kind of contact. Or when children go from one house to the other, it goes with the child. When people go to work and they're not wearing a mask, or they're talking to a friend on the street and they're not wearing a mask, or they're shaking hands or sharing a pipe, those are the everyday small things. This isn't really big parties or people doing crazy things. These are quite small things. People sharing a car ride together and not wearing a mask. It's little things like that is where we're seeing the transfer happen.
Yeah, thanks, Jeroen. And that's a really interesting point, actually, which leads me straight through to our next panelist, Rima. Jeroen just touched on mask wearing, and I think we've been hearing all about masks and social distancing and, doing the things that will help prevent COVID. But can you tell us a little bit about why these practices are so important?
Yeah, so thanks, Maysaa. Assalamu alaikum to everybody.
Walaikum salam.
Thank you for joining, and thanks for the opportunity to talk. And I have to say, I just want to be here to talk to everybody because we're all frustrated with the situation. We're all suffering together. It's hard. We want to get out of it. And I know we've done this before, Victorians. We're so compliant. We're so good. And we want to do this again. Together, we can do this again. So how can we do this together? Basically, let's talk about why PPE, all right? So personal protective equipment or covering, such as mask wearing and distancing is so important. Think about a surgeon. Surgeon goes in to do surgery. They wear a mask. They're protecting that patient, okay? So now what we're talking about is this virus, and this virus is everywhere, and we've got to treat everybody as if they have that virus. This is how we have to behave now, because this is such a highly transmissible virus. So we should be wearing the mask to protect others. And we know the virus jumps from one person to another. We know it's well documented. It jumps within a meter. It's now become even quicker than that. The virus has evolved and has even become more tricky, and has decided, I need to get to the next human. And because it wants to thrive and wants to get to the next human, that is how it lives, and it reproduces and keeps going. And that is the link It finds that human that can basically harbour it. By wearing a mask, we are protecting others. By isolating, we are protecting others. And by, doing all the right things for example, hand sanitizing, washing, we are being proactive in stopping the spread. The other thing too, let's go back to basics here. Before COVID-19, before the pandemic, when you have a cold, when you go to school, they say go home because you don't want to give it to the school community. You don't want to infect the other children. You go to your workplace, they say go home. You don't want to infect your workplace. This is the same, and we are now dealing with a more infectious virus, more infectious than any other virus we've had so far. I mean, and this is a common practice with infectious diseases. Any infectious disease, what we do is we test, we isolate, and wait for a result, and then we make a decision about what happens. It happens for a lot of infectious diseases. Back in 2009, I was practicing as a pharmacist. It was a swine flu outbreak. I don't know if anyone remembers, but we did testing and we did isolation. So this is nothing new.
Yeah.
This is well-documented practices. Sorry, Maysaa.
No, don't be sorry. I was just going to say that I think that as from a human behavioral perspective, once something's in the spotlight and we've been given a direct order, that's when humans kind of are alerted and become very fearful, because when something's unknown, that's when we kind of shut down and go, mask? What mask? We can't breathe in these masks, for example. So that's why it's really important to understand the science behind it. And, I guess the next step is, well, when do we stop wearing masks? Is there an end to masks? How are we going to be free again?
Yeah. So of course there will be the other side, but we need everybody to work together to get to the other side. And I'm going to say vaccination, and I know that we're going to talk more about that. Okay.
Yeah.
But let's go back to the mask wearing, the isolation, and the why we isolate and why that's so important. What got us through last year?
Yeah.
Remember that, what got us through last year, which is exactly that. We tested, we isolated, we worked out who the people had contacts with, we were able to isolate them. And I know Jeroen has been an absolute champion of leading that directive. And hats off to Jeroen and what he's done for Victoria. So
isolating is really underrated in what you're trying to explain how important isolation is.
So important. Yeah. Okay, because I mean, think about your family members. Okay, so just think about the most important people to you, your closest family members. You are protecting them. Okay, because imagine you have it or suspected of having it, and then you go mingle, okay, and you give it to them. How bad would you feel knowing that they'll go to hospital and ICU? Because this virus doesn't discriminate between the old and the young, and it's basically the young people who are fit and healthy, when they're infected, are ending up in hospital, and we don't know why. The doctors and the clinicians cannot even tell us why a fit and young person infected with COVID-19 is being ventilated. So if the doctors and the clinicians cannot tell us that, why are we being why are we resisting these behaviours that could save our loved ones, our children, and our family members?
Yeah, thanks for that, Rima. I'm really interested actually in hearing from somebody that actually has COVID, is COVID positive. We've got Nasreen here tonight, who has graciously, offered some of her time to talk about COVID from a personal experience. I want to say thank you, first of all. I'll ask you to unmute yourself. So I'll just go there. Yeah. Nasreen, hi. Salam alaikum. I just wanted to have, if you could give me an idea of, how did it unfold with your family? Tell us a little bit about how you found out you were COVID positive.
Yeah, well, Assalamu alaikum. I just want to thank you first for giving me this opportunity
to
Very
share my
welcome.
experience. Yeah, well, we were notified last Wednesday that my son's childcare was a tier 1 exposure site, and we went out straight away and got tested.
Did he have symptoms, Nasreen? Did he?
Not on Wednesday night. We couldn't get a test for him that night because he's under age of 5. He's 22 months. So my 5-year-old got tested, and myself and my husband, and we all received a negative result. And then on the Thursday, we first thing in the morning went to the Royal Children's and got him tested. So
it was your younger child that caught COVID?
Yeah, my 22-month-old, yeah.
And he could only be tested at the hospital?
That's right, yeah. So the Royal Children's were amazing. They called us up that evening and let us know that he was COVID positive, and that they offered all their support, and they gave us they gave us a rundown of everything, and they kept calling. They gave us, the pediatrician gave me her personal number, and it was just really it was obviously really distressing for me because
how did you feel at that moment as a mum of 2 kids and now COVID's entered your house?
It's probably one of the hardest moments. Like, it was really intense and really hard to deal with, because knowing, a lot of things running through my mind as, what do we do now, and what's going to happen to us, and who have I infected, where have I been, where have I gone, and it was really intense.
I bet. Take your time anyway in retelling this story, but what happens next? Are you all alone? Do you get any phone calls? Is there any assistance? How did you find out that you were positive?
So after my son tested positive, we kind of assumed that, it's only a matter of time until we received the news that we'd get the positive. Within a couple of days, we started developing symptoms.
What were those symptoms, Nasreen?
Started off with a really dry chest, and I was like looking at my husband and asking him, do you have it too? And he's like, yeah, I have it too. And like, is this it, or is it in my head? And then it just started to progress from there. And we went to bed and woke up, both of us, in chills and really fatigued. And obviously my 22-month-old was experiencing symptoms as well. And he was really unwell, and being unwell myself and caring for him was really hard. And and I'm still not well. And every day is different, and the symptoms are really sometimes severe and sometimes not. And I feel like today I had moments where I was struggling to breathe. It's just one of those things that it's just been really hard from the beginning, that not knowing what's going to come, and you read things online, or you obviously we've been hearing things from the beginning, and it's just, I think there's a lot of anxiety behind it. And we've been receiving so much support from the department. They've been calling us almost every single day. From the beginning, from the Wednesday we received the message, then we got a contact tracer call us on Thursday. And then from then on, we when my son did test positive, straight away we had the medical leads call us, so the doctors with the department, and then the contact tracers, obviously. And my recommendation from all of this is, like, keep checking into wherever you go, because I was doing that, and that helped them a lot.
The QR codes, is that what you're talking? Yeah. So wherever you go, check in, and that kind of helps you trace your last steps. We shouldn't be gallivanting about town, but sometimes we forget certain places that we went. Nasreen, did you have to get a second test? Because I know you said you tested on that Wednesday. Did you have to do a second test?
So we did, because what happened was he received the positive, but it was a weak positive. They couldn't pick up on another protein or something that she tried to give to me, but I really don't remember.
Of course,
we did have to do a second test at the Royal Children's, and then we received another positive, and then we actually tested negative twice.
Really?
And then obviously, as we were, he's 22-month-old, so it's obviously goes to show how infectious this virus is, the fact that within a couple of days the whole family had tested positive. And so now we're just at home alone. Obviously we have the support, the mosque, the Preston Mosque has been amazing, the ISNA has been amazing, and the childcare has been amazing with helping us.
Of course.
When you're sick and you've got your kids and your husband's sick, it's just been really.
really hard.
And as a parent, I can, and all the parents out there can totally try to imagine anyway, isolating with 2 young kids. So really, our hearts are with you and sending lots of dart and good vibes your way, basically. Thank you for sharing your story. I do have one more question to ask you. This feels like one last piece of advice, but what do you say to, some people out there in our community and not in our, wherever, that say corona's not real, it's not around, it's just the flu, we can just get over it?
Yeah, like, honestly, I can't believe we have to keep trying to justify ourselves that it's real, because, does it take somebody in your family to get really unwell for you to believe in it? We should be listening to the health advice, and it is real. And, I have my firsthand experience, obviously. I didn't need someone to get sick for me to believe in it, but unfortunately I wasn't protected. I only had I wasn't fully vaccinated. So just while you can get vaccinated, while you can protect your family, stay at home, and this is real, and protect your family, protect your parents. And yeah, like, I just don't know what to say. Like, it's not an easy virus to get, and it's not something that's anything like the flu, or anything like anything I've ever experienced in my entire life.
I think we just received a question asking if you were vaccinated. So I think you just took the one dose, is that right, before you fell sick?
So
yeah.
I received 1 dose of the Pfizer less than 7 days before I was positive. So obviously that wasn't enough for me. I wasn't fully vaccinated. So yeah, which is unfortunate, because these whole lockdowns and these are in place for us to get vaccinated and to protect the ones that want to be protected. So, we need to just stay calm and stay patient and get through this until we're all vaccinated.
Inshallah. Thank you. You're receiving a lot of love in the chat and in the question box. Ladies and gents, everyone out there, there is a little Q&A box at the bottom of your screen, or maybe if you're on the phone, it's on the side. So if you've got any questions, if you want to send some love, send some dua to Nasreen and her family's way, that'll be greatly appreciated. I want to talk to Dr. Amrooha. Assalamu alaikum. Hi, Doctor.
Alaikum salam. How are you?
Yes, good, alhamdulillah. Thank you so much for being on here. I wanted to ask you, as a practicing GP in the community, what are you seeing? What are you seeing in regards to the virus? Does it affect any particular age group?
Jazakallah khair for the opportunity to speak today. Certainly from a general practitioner point of view, there's a few key messages that I wanted to get out to the community. And I first wanted to thank Nasreen for that powerful conversation, because really that's something that a lot of people need to hear firsthand from someone who's dealing with COVID at the moment, because they're conversations we have over the phone with COVID positive people as well as a general practitioner. The other thing, I like Nasreen tested because she was tier 1, but when we're talking to patients, we send them off for a test when they're symptomatic. And what I've noticed is that people are presenting very late for testing, and that for me is it's a key point that I really wanted to get across to people, is that so I have frequently had telehealth consultations with people who are ringing 2 weeks in from symptoms, and that's too late. By that time, so many people would have become infected. That means contact tracers have a really difficult time to pinpoint where you've been. So I guess the main message from a general practice point of view is, first of all, call us. Don't come into the clinic. Call us first, discuss your symptoms, and get tested as soon as you get even the slightest of symptoms. And I know that that's repeated often, but I don't know that sometimes it doesn't sink in. I myself had a test on Tuesday because I'm a doctor. I need to protect my patients, and I had a bit of a headache and a sore throat. I went and got tested. The result came back Wednesday morning. I was feeling better and I could go to work on Thursday. So, and as health professionals, we've been tested so many times. Like my family's had over 30 tests for the whole pandemic, because I need to protect my patients. And I think that's what I would like the community to understand, is that every test you do, you're protecting your loved ones, you're protecting your whoever you're coming in contact with. So if you're an essential worker, you're protecting other essential workers. As for the cohort of people that's being identified, I think it's clear from the statistics that it's a younger cohort. What Jeroen's already mentioned, that it's an unvaccinated cohort. And so these are, again, the same messages that I'd like to get out there, is that if you are now there's a huge proportion of the population that's eligible. And so the best thing you can do to protect yourself and to protect the community is to get vaccinated, but the public health orders cannot be ignored either. I think it's really important that people understand that it's a combination of the two, and that's going to be ongoing for a while until we reach a level of vaccination that's going to mean some lifting of restrictions. But this virus is here for a while, and we do need to have some behavior changes, and I think that's some, hopefully, we can all give that attention in future forums perhaps.
And Doctor, I just wanted to ask you, I mean, I guess, I don't know, a lot of people out there might think that they're being a little bit whingy, or maybe they're being over the top, because you are suggesting that, if you do feel something, get tested ASAP, call the, via telehealth, call the GP to get some more information on the symptoms. I suppose I'm asking you to make it clear that in this time and, era that we're living through, calling to check in or getting yourself tested is okay.
It's absolutely okay, and there will be no employer out there that can really say anything, because what you're doing is actually protecting your employer, and you're protecting so many people. And there, if you do need to access that $450 payment, that's available as well. I mean, there's so much that's become available in order to help you get tested. We can issue you with a certificate. The place that you go to get tested, they will also issue you with a attendance. So really, there shouldn't be that hesitancy to get tested, and it's really, besides vaccination, it's all we have, to be honest. Like, I'm sure Jeroen will agree that if we don't know where the virus is, how can we ever chase it down? And testing's the only way. Testing's the only way you can, and there's no clinical way of knowing that this is coronavirus or any other virus. Testing's the only way we can tell the difference.
Thank you, Doctor. I'll pause you there for a second, because I've got a question here that I want to divert back to Nasreen. So Nasreen, someone's asking here, which I'm guessing from your story, when your son became COVID positive, it was a really quick turnaround before you realized that you had symptoms or you started to feel sick, because they're asking, can you advise us what to do in case, our kids do catch COVID and you're a parent in the house with them? What was your experience with that? Was it too late? Did it already happen? What was your experience with that?
Honestly, it just really happened really fast. Wednesday night, we received the news, and then Thursday we tested. Thursday night, so Wednesday night we received the news. Wednesday morning we woke up and he had a temperature, and by Thursday when we did test and then we did get the positive, it just happened really fast. And so by Sunday night we started registering symptoms. So it just happened really fast. By Wednesday, before we tested on Thursday morning.
That's okay.
It was really apparent to me that it probably was COVID, because the center is a really small center, and the fact that she was the instructor was the educator was infectious for quite a few days. I already knew, like, before that we did the test, that this is probably COVID.
Yeah, and I guess we can talk about that more scientifically and precisely from an expert herself, Dr. Haloom. Hello, welcome. Assalamu alaikum. Nasreen just touched on that fact, and I'd love to talk to you about, tell us a little bit about the Delta variant. How is it what is it? Where is it? It sounds like it's just so strong and it's so contagious. Is this a fact from your expert opinion?
Walaikum assalam, and thank you so much for having me back on the panel.
Welcome.
So to understand what's happening to the Delta variant, we need to understand how viruses actually change. So viruses have a really high mutation rate. So what that means is when they reproduce inside our bodies, the copies of the virus aren't exactly the same as the original virus that you got infected with. There are minor changes. And sometimes those changes can cause an advantage in the virus that can make it, for example, more infectious. And that's what we've seen with this Delta variant. At some point in somebody, it has mutated, it's become more infectious. And because it is so infectious, it's basically taken over the majority of the other Delta variants and other coronavirus variants, and it's become the dominant variant. Even though it is more infectious, fortunately, what we're finding is it's not necessarily causing worse disease compared to the original one, but it does mean that it is spreading through the community a lot faster. So if you do have the Delta variant, you're much more likely to end up infecting other people, which is why it's so important to stay home. Don't leave unless you have to, wear your mask, as Rima mentioned earlier.
Yeah. So Dr. Haloom, essentially you're saying this is an even stronger, strain of a virus than what we witnessed last year.
Stronger in terms of the way that it spreads so quickly. Yeah. So
quickly, which we've just heard, ladies and gentlemen, from a firsthand experience of Nasreen, pretty much 24 hours later, her whole family had caught COVID. So in saying that, I'm going to be a little bit of like a devil's advocate here and just ask you, in terms of vaccination, doctor, we're hearing from the government, vaccinate, vaccinate, vaccinate. Can you tell us from your, again, from your profession and your expertise, why and how does vaccination work?
Okay, so let me just explain for a bit what vaccination actually does. So we know that when we get infected with the virus, our body has an immune response to fight off that virus. And then the next time we get infected with that virus, our body is ready to go and can attack it really quickly. So what the vaccination aims to do is basically prime and ready your immune system so that by using essentially, so you have the mRNA and the DNA vaccine. So what they do is they introduce a part of the virus which doesn't make you get sick, but it exposes your body basically to the proteins of the virus, and it lets your immune system attack that protein and recognize it. So when you do become exposed to coronavirus, it can launch a really strong, really quick attack against the virus and prevent you from getting sick. Or for some people, you might still get sick, but because your immune response has been so much quicker and so much stronger, you don't get as sick. In the majority.
So tell me about those people that proclaim that their immunity is strong. They go to the gym. They have their vitamin C every day. Can they fight COVID just like that?
Look, unless you're malnourished, taking vitamins isn't really going to make a huge difference to your immune system. Vaccination, it's not about boosting or making your immune system stronger in general. It's about exposing you to that protein from the virus so that your cells it's what we call our adaptive immune system. So basically adaptive in the sense that it's changing in response to the stimulus from the environment. So it's ready to go when you are exposed to COVID-19. So I just want to say the vaccines that we have in Australia, they work, they absolutely work, especially if you've had both doses. We know that there's a 90% reduction in hospitalization and serious illness in people who've received both doses of the vaccine. That's huge.
That is huge. I love that. We need that cut and copied, highlighted, bold, underlined, everything. But I have received a question asking, is this vaccine safe for children?
So it's not approved for use in children yet. So obviously that's not my decision to make. So we have the TGA, the Therapeutic Goods Administration.
Haloom, today ATAGI has put out some guidelines that is approving the use of so I'll just walk you through it if that's okay, because I know it's frequently changing, the guidelines. So just if I can take people through that. So ATAGI is the Task Force for Immunisation. They're the specialists that get together regularly to evaluate the TGA information. And so they have actually gotten together today and approved the Pfizer vaccine for children above the age of 12. And you already know about the Victorian State Government implementing now, allowing now for children above the age of 16 to receive the Pfizer vaccine. So that's already occurring. My 17-year-old has been vaccinated just yesterday. So basically, the Australian government will, I think later in mid-September, that will become mainstream for 12 and above. And there's still trials going for those under 12. So if you notice a country like like Canada, for example, they have 75% of their children vaccinated with dose 1, and 50% have had 2 doses. So this is something that's already occurring overseas, and you know, inshallah, we'll be moving towards that. So I want to reassure people that that's really a very promising sign. And certainly, like I said, I've had my 17-year-old vaccinated. I'm looking forward to getting my 13-year-old vaccinated very soon.
So I think there's 3 trains of thought here in terms of vaccination. One, you know, one group of people are happy to do it. Yep, give it to me. I agree and believe in it. There's a second group that's like that pretty much falls into the category of maybe I'll wait, maybe I'll keep waiting. You know, they'll get better and better at making a better vaccine. I don't know if I'm using the right terminology. And then there's the third group that pretty much says, oh, I don't like the ingredients that's in this, and it's full of chicken, eggs, and I don't know what else people come up with. What do you, or both doctors, I suppose, what do you come up with things for about things like that?
Yeah. So as for group 1, you know, I say congratulations and go for it. Group 2, you know, I want to wait and see group, and I understand that mentality, but what I want to just point out is that when an outbreak arrives, and you can talk to Nasreen, when an outbreak arrives, it just arrives. There is no notice. You don't get a heads up that that there's going to be an outbreak in your center or your workplace or your community. And so whatever you can do to you know, get vaccinated at the earliest possible opportunity is just giving you that time, because unfortunately we can't see into the future. And the reality is that at some point in the future, we are all going to meet COVID. I mean, the majority of the population is vaccinated, not now. And I think that's why we have to just really, I'd say to group 2. To group 3, I would say, you know, I really want people to question where they receive their information from. Turn to experts, and I've had some people say to me, but there's some XYZ doctor said this, and I just want people to understand that I want you to look at the global community of doctors. You know, there's always going to be outliers in every profession, even in the religion. You know, you look at the ijma' of the ulama, you look at the mainstream ulama, the scholars that are all together. You don't look at the outlier ones, right? Same with the medical fraternity. Look at the global community, look at the reputable medical community for your information, and you will be reassured. And look to reputable sources. And that's what I'd urge
Google your WhatsApp stories from your aunt's best friend isn't enough information.
No. You know, and we have to be discerning, and we are a discerning people, and we just have to take that extra time and effort to not fall for things that are, you know, there's no reputable source supporting it.
I suppose it falls back down to, and I don't know if you know, anybody can actually answer this, but the fear behind getting that vaccination. Am I going to catch something? Am I going to become allergic? Am I going to trigger a heart issue? There's that fear. What can we do about this fear?
So, sorry, no, you go, Dr. Umruha.
No, I'll quickly say that. Look, when it comes to medical procedures or you know, pharmaceuticals or anything of in our profession, I mean, nothing is risk-free, and actually not even outside of the profession. You know, life inherently is not risk-free, and so we do have to understand that there's an element of risk in everything we do. Even when we step one foot outside our door, there's risk. Inside our home, there's other risks. So I guess it's coming back to evaluating risk, and clearly the evidence is that vaccination far outweighs, you know, in benefit compared to what's happening with COVID. Vaccination is, you know, far and away recommended, and the benefit outweighs the risk.
Yeah. So
yeah, go for it, Rima. Go for it.
To add that the virus is hunting down the unvaccinated. Look who's ending up in hospital. It's the unvaccinated, or the ones who haven't had their full course of the vaccine. So the other thing is we're 1,000 times more likely to die from COVID-19 than experience any significant side effects from the vaccine. The clinical trials have been, usually clinical trials are, only 3,000 people. The clinical trials that have happened for these vaccines have involved 30,000, and now we have billions of people taking these vaccines, and the benefits are ridiculous. You just have to look at the UK and see what's happening in the UK. Over 70% vaccination rate. Before that rate, we were getting over 10,000 deaths a day, right? And now we're getting only in the tens of deaths a day.
And I guess, Rima, thank you so much for pointing that out, because, Jeroen, the plethora of questions that I'm receiving, so sort of from my end, I can see all your questions, and I would say 80% of them are all about, when can our kids go back to school? So I am totally appreciative of this question. I've got 4 at home myself. I know that Jeroen's got children. We've all got children, most of us. But the point is that you've got to take a lot of what the panelists today explained with this question of when can our kids go to school? Jeroen, for the $1 million question.
It's a great question, Maysaa. And can I just say, what an amazing panel. I'm in awe of all of you, and Nasreen especially. I think the way you spoke was just beautiful,
well done.
and so moving. So thank you for sharing that story. I know it's a very personal story. Look, I think there's 2 answers to that. We desperately want to get the number of active cases down now in the way that we have so many times in the last 8 months. So we've seen lots of smaller outbreaks in Victoria. It's taken us usually 2, maybe 3 weeks to get on top of them and to get it right down again, and then we can open up again. And we are absolutely convinced that the team that I work with, we are absolutely convinced that we can get the cases we have today under control in a few weeks. But we need everybody to do the things that Nasreen and Dr. Umruha and others have been talking about. Just to get it under control. That's the first answer, because if we can do that, then the kids can go back to school in some way or another, in the next month or so. That is genuinely possible, but only if we get these cases down.
You're throwing out a few dates and a lot of hearts, a few weeks, and then there's a month.
Okay, so I'll be very specific. So I don't have an exact timeline, but if we got these cases back down to only cases in quarantine, 0 cases in the community, then I think we are, once we get to that point, within 2 weeks of that point, we could start to see something happening at school again. That's what we would want to do. So I just want
to make a note and add to that. Everything was closed down when the Maysaa outbreak happened, and the only thing that was open was childcares, and we were affected. So it just goes to show how rapid it spread, and I think that's the best example, really. And that they did end up closing the childcares after our case, but it's just kind of like trial and error. But it just goes to show how rapid it is, and we need to protect our community.
Yeah, thanks for that, Nasreen. Jeroen, just on that, like you're bringing up the vaccination issue and kind of bringing the numbers down, but a lot of people are asking, when can we introduce rapid testing? When can we quicken the 2 dosages, the time spent between both dosages? I think unmute. There you go.
As Dr. Hammer said, as you said, so the advice now from the government is that vaccine is now okay for children from 12 onwards. We will start vaccinating children from 12 onwards, I think, realistically in 2 to 3 weeks' time. And we will see a lot more vaccine arrive in 2 to 3 weeks' time in Victoria, and we will start to vaccinate people. I think it'll take us until November, December to get everybody vaccinated who wants to get vaccinated, that sort of timeline, so November, December. But in the meantime, we want to get the cases down so we can start to get people back into school and to do those other things. And I think that is genuinely possible. We are looking at alternative testing options, and they've used them in other parts of the world. The reason we use the rapid tests a little bit in Victoria, but in very limited ways. One of the problems with the self-test, and they use them a lot in the UK, is that they're not as accurate. They're only about 50% as accurate as the PCR test that we use here. So we're a little bit concerned that if we deploy them in Victoria, we end up with false confidence, and we still end up with cases in our schools, in other settings, and then we forget. So that's what we're dealing with.
Some parents are getting a little bit frustrated. It's getting a bit hard for children. You know, one mum, Miriam, has said here, you know, it's her daughter's 6th or 7th time of doing a test, and it's kind of getting harder and harder to get this child to do the test. So in cases like that, the rapid testing would be a great idea.
Yeah, look, and we're also using saliva testing. So you just, you know, you suck on a piece of paper or a strip, which is much, and we use that in many other places. So so that is the other option. We use saliva, and I think that's something we're looking to use more often.
And so another question, forgive the, you know, the kind of naivety of this question, but why can't the government buy, you know, 10 million Pfizer vaccines and just give it out? Because the Lebanese community, I'm going to speak on behalf as a stereotype, have this belief that Pfizer is the best. It's the most it's the most safest. I know my auntie's best friend's brother will only take Pfizer. I know, you know, Nasreen's got a few stories herself. A lot of people just want Pfizer. They want to go to the GP, give me the Pfizer, I'm done. Tell us about that.
I think it's not only the Lebanese community, Maysaa. I think there's quite a few communities that feel exactly the same way. We just want to have Pfizer. I've had AstraZeneca. I'm still okay.
I've had 2 AstraZenecas.
Okay,
exactly. We're fine. We're both fine. So we're pretty happy. But the look, I think there is let's be very honest. The Australian government was late in buying Pfizer. It took a long time, and we are therefore 3, 4, 5 months behind where other countries are. And you know, we're all frustrated. I'm frustrated. We're all very frustrated by that.
So that needs to be clear.
So that's look, and that's a mistake that was made. I mean, you know, and look, I'll apologise for that on behalf of the Australian government too. But there is now Pfizer coming. So anybody under 60 can now get Pfizer. And the volume that's coming through is increasing every day. 300,000 people booked in the last 2 days. There'll be more slots coming up. By the time we get to October, November, all of us will be able to get vaccinated with Pfizer. The older generation will still be expected to get AstraZeneca. That might change later at the very end of the year, but for now, just get it done. Just get people vaccinated, because we want to move on.
And I just wanted to say that the vaccine, when it's sitting in the fridge, it's not doing any good to anyone. It needs to be in your arm, and you know, two weeks post your second dose is when you're going to get the maximal protection. So I'm appealing, as a GP, I'm appealing to all those people over 60. Do not delay your vaccination. The numbers are in your favor with regard to any side effects. I'm happy to go through it with people, you know, if they need to, but that's a really important message. I'm just noting in the chat that somebody's written that the elderly community are very scared. And I think that's, you know, I'm not sure if they're the type that would attend a webinar, but it's incumbent on their family members that are listening to talk to them.
Pass it on.
Whoever, you know, if you've got elderly relatives, please have that conversation with them. Take them to their GP. We've got lots of AstraZeneca. They will be protected, and very quickly. It's really important.
Can I add the AstraZeneca too, please? It's a fantastic vaccine. It's really it's received such, you know, negative publicity. It's unfortunate. It's a brilliant vaccine made by Oxford University. They've shared the intellectual property with everybody, which is why Australia was able to make it locally. It's got fantastic efficacy. Everybody's scared about the clotting issue. The clotting is not something, if you've got a family history of clotting, which is why you should speak to your GP about it before getting it. The clotting is because of actual COVID-19. COVID-19 infection, the disease actually causes clotting, but it's very, very rare. But I just want to say that AstraZeneca vaccine is a fantastic vaccine. A lot of my family members have had it. My mother, my father, my mother-in-law, father-in-law, brother, cousins. it's a safe vaccine. Speak to your doctor first.
There you go. You heard it from an expert herself. Yes, go for it, doctor.
With the clotting issue, it's also more common in younger people. So for those who are over 60, they're a lot less likely to get clots. And, you know, when you get the vaccine, you're given a long list of symptoms to watch out for. So if you do get those symptoms, you know, straight away, go to hospital so that you can be checked out. And at the end of the day, if you catch COVID-19 and you're over 60, your risk of serious illness is just so much worse than any potential risk from the AstraZeneca vaccine. And yeah,
that's a stark reminder. Thank you for that. Jeroen, I've got two questions your way, and then I'm happy to kind of start to wrap it up. But the first one being that in terms of schooling, I think parents, as a coach myself, and I see hundreds of parents, you know, on a monthly basis, the fear is the mental health. Mental health is deteriorating. We've seen statistics, we've seen numbers, they are heartbreaking. Teens are wired to not be with their parents. Like that's just what they're made for. I know you've got them, I've got them. Surely the government can come up with a way to assist teenagers, or perhaps a sort of A-B system. You know, even the little kids need to run around. My son today proclaimed, he looked me dead in the eyes and said to me, "Mum, it's not like we like remote learning. We don't like remote learning. So don't ever think we like it." Tell us a little bit about how the government can, or maybe you can pass on the message on behalf of all parents. We just want a little bit of understanding, a little bit of an olive branch of hope to do with mental health for these children.
And look, it's something, Maysaa, and it's an absolutely fair question, and it's something that, in the decision making that we make as a public health team, it weighs really heavily on us about is this the right thing to do, and the contrast, and it's a difficult contrast. If we look at our friends and neighbours in Sydney, they're living in the same conditions we're living in, but there are literally hundreds of people in hospital. So we have over 700 people in hospital in Sydney. We have, you know, they've lost about 100 people who've died in the last six weeks or so. And they're living with the same lockdown conditions we're living in. So the problem with COVID is it's such a cruel thing, but once it gets out and it becomes widespread in the community, the risk to people's health and people losing their lives, unvaccinated especially, becomes really significant. And you still have to lock down, and that's with lockdowns trying to slow everything down. So it's you're in the same position. So it's the challenge for us is, apart from getting everybody vaccinated, we don't really have an alternative to lockdown once you have it in the community. And the only thing we can do is, if we get it out of the community, then we can get rid of lockdown.
And that's the jagged,
that's a
jagged peel. Yeah, that really is a tough thing to kind of accept, but we need to get that out there. Vaccinations will end the lockdown. Is the government discussing any plans of restriction removal for those that are fully vaccinated? Are we going to turn into that society? Fully vaccinated get one rule?
I think in the long run, I think when everybody's had a chance to be vaccinated, I can see, that's not a policy, but I can see getting to a world at the end of the year, early next year, where people will say, well, now you've all had a chance and there are now choices to be made. There's no way we can hold people back. We're all suffering in this lockdown, all of us. And Nasreen referred to it. We've seen, even when we just had childcare open for not all the kids, just for a small number of kids, it still got in. So when you have it in the community, it'll.
Can we ask public schools to start administering? Guys, I'm asking your questions. Can we ask public schools to start administering vaccines?
I think we will, and one of my team who's on the call at the moment. I mean, I've got the most wonderful women who work on my team who do the real work, of course. And Naomi and Mia are working on schemes at the moment around how do we work with schools to deliver vaccination for children. So when we're starting to do vaccinations for 12 to 16-year-olds, how do we do that? So we're working on those options now. It won't be next week, but it will be something we do this year.
There was just a question, I'm sorry, on that note, somebody had written that there's vaccinations for 12 to 15, but not VCE. And I just wanted to correct that misconception that certainly, anyone who's over 16 can access the vaccine, and that would include VCE students. That's current.
Yeah. Jeroen, is the government's fixation on zero realistic? That's a question that's come through. Community cases. Yep.
Yeah, we discussed it today, Maysaa, and we think it is still possible for us to get to zero. But to be very clear,
Wow.
and we've said this publicly a few times, it is not about we will be in lockdown until we're at zero. It is about being in control, and so we could have positive cases, but people who are isolating and who are quarantining and we're comfortable. That I think would be sufficient for us to start easing restrictions. The problem is at the moment, if I'm really honest, we're not in control at the moment. You know, when today we saw 79 new cases today, 46 in the western suburbs, 46 in Newport, Altona, Wyndham, right in the heart of our communities. We don't have control of those 46 cases, and the danger is that tomorrow those 46 cases become 80 cases, and it grows. That's what we're worrying about.
I think this member of the community is asking that, rather than the focus being like the metric being community cases, should we start looking at vaccination numbers and the number of hospital admissions instead of community cases?
And we will at some point. And I think when you get to 80% vaccination rates, that's when I think the whole dynamic starts to change, because then you can say everybody's has an opportunity to be protected. And we can start to then really worry about the impact on the health system. But the problem today, at the moment, only a quarter of those under the age between 18 and 30 have had a first dose. So 3/4 of younger people have not even had a first dose. So it is too early, although it's very tempting for me to say, don't look at the cases, look at the vaccine numbers, because the vaccine numbers are getting better. Actually, I've got to do both. I've got to drive hard on vaccines, and the GPs are doing the most amazing job on the vaccines as well. But at the same time, try and keep those numbers down. And it's a bit of a race. You know, if we can keep the numbers down and it's literally, if we can hold the numbers down for another 100 days, then we will have the majority of the vaccination work done. But we need these 100 days are really important, because otherwise we'll be in lockdown for 100 days, and nobody wants that.
Yeah. I think it's been a really wonderful discussion. I feel like we have covered so many points, ladies and gent. And I really believe that with the information that you have received tonight, spread, this is recorded, by the way, this will be saved onto the IMA socials. Spread accurate information is essentially the message we're getting tonight. There are so many questions coming through. I've tried my best to get through as many of them there were some medical questions. See your GP, see your GP, see your GP. Do not Google. I just want to say thank you. Thank you to each and every one of you tonight that has shown up either as a audience member, because we really need you all to spread the message. There are questions here saying, you know, how can we encourage people to admit their movements? By lessening the fear. So the fear behind, oh, we will be punished, we will receive such and such, has got to go. We heard from Nasreen herself, you know, a COVID-19 positive person living in the community. You've got to just be aware of what you're doing, where you're going, where you're transmitting it. This disease spreads quickly. Thank you to Jeroen for, you know, answering a few of those tricky questions. I really appreciate that. Thank you to Dr. Haloom, Dr. Umruha. Loved both your experiences and expertise. Rima, amazing. The passion there behind explaining the vaccines was really incredible. I would like to just ask Jeroen if you wanted to end on any note.
Maysaa, thank you so much, and thank you everybody for being here and for giving me your time to talk with you and to listen. I've learned so much tonight, actually, from the rest of the panel, and I think Nasreen's words are going to stay with me for a very long time indeed. So look, please everybody, don't listen to me. Please listen to the other panelists and follow the instincts and keep safe yourself, keep safe for your family, and keep safe for your community. We could all do this together, and if there's anything else that we can do to help you, please let us know. Thank you.
Thank you. So,
Maysaa,
yes, Rima. Sure.
I want to say to all those mums out there and all the taters and all the, you know, amtos and the kholtos, get your sons to go get tested. If they're sniffling, if they're coughing, if they've got a sore throat, they listen to their mums. Just get them to go get tested, because It's so important with this highly infectious virus that we track it, we get it under control, because the last thing we want to do is hurt somebody, hurt our child, them ending up in hospital, and then we feel responsible. I mean, that person who passed it on will feel responsible without knowing that passed it on. This is why we need to do it, to prevent that death from happening.
Thank you, Rima. I think we could talk for hours, and I love that. I love that this group has been so passionate. It is so sad to say, but we've come to the end of our discussion. I want to thank each and every one of you once again. I want to remind everybody out there that testing sites are available tomorrow at the Islamic Museum of Australia from 9 to 5, at the Newport Community Hub from 9 a.m. onwards. They are there. Testing sites are there for a reason. Scan, face masks, social distance, and please look after your mental health. There is a plethora of information about what you can do during lockdown. I have to be fair to myself and just include that in there. I know that we've touched on science, but from a mental health point of view, it is vital that we keep ourselves intact. Lockdown can feel like a sentence unless we do something to change our brain capacity and our mindset towards a growth mindset. So with that being said, thank you so much. Good night, everybody. Salam alaikum.
Salam.